1. Peanut oil is a great source of vitamin E. Just 1 tablespoon of peanut oil contains 11% of the recommended daily intake of vitamin E. Vitamin E is actually the name for a group of fat-soluble compounds that have many important functions in the body. The main role of vitamin E is to function as an antioxidant, protecting the body from harmful substances called free radicals. Free radicals can cause damage to cells if their numbers grow too high in the body. They have been linked to chronic diseases like cancer and heart disease. What's more, vitamin E helps to keep the immune system strong, which protects the body from bacteria and viruses. It is also essential for red blood cell formation, cell signaling, and preventing blood clots. This powerful antioxidant may reduce the risk of heart disease, certain cancers, cataracts, and may even prevent age-related mental decline. Peanut oil is high in both monounsaturated MUFA and polyunsaturated PUFA fats, both of which have been researched extensively for their roles in reducing heart disease. There is good evidence that consuming unsaturated fats can lower certain risk factors associated with heart disease. For example, high levels of LDL cholesterol and triglycerides in the blood have been linked to a greater risk of heart disease. Many studies have shown that replacing saturated fats with MUFAs or PUFAs may reduce both LDL cholesterol and triglyceride levels 6, 7, 8. A large review by the American Heart Association suggests that reducing saturated fat intake and increasing your monounsaturated and polyunsaturated fat intake could lower the risk of heart disease by as much as 30%. Another review of 15 controlled studies had similar findings, concluding that reducing saturated fats in the diet had no effect on heart disease risk, although replacing some saturated fat with polyunsaturated fat may reduce the risk of heart events. Yet these benefits were only seen when replacing saturated fats with monounsaturated and polyunsaturated fats. It is unclear if adding more of these fats to your diet without changing other dietary components will have a positive effect on heart health. Additionally, it is important to note that other major studies have shown little or no effect on heart disease risk when reducing saturated fat or replacing it with these other fats. Studies have shown that monounsaturated and polyunsaturated fats may improve blood sugar control in people with diabetes. Consuming any fat with carbohydrates helps slow the absorption of sugars in the digestive tract and leads to a slower rise in blood sugar. However, monounsaturated and polyunsaturated fats, in particular, may play a bigger role in blood sugar control. In a review of 102 clinical studies that included 4,220 adults, researchers found that replacing just 5% of saturated fat intake with polyunsaturated fats led to a significant reduction in blood sugar levels and HbA1c, a marker of long-term blood sugar control. Additionally, replacing saturated fat with polyunsaturated fat significantly improved insulin secretion in these subjects. Insulin helps cells absorb glucose and keeps your blood sugar from getting too high. Animal studies also suggest that peanut oil improves blood sugar control. In one study, diabetic rats fed peanut oil experienced significant reductions in both blood sugar levels and HbA1c. In another study, diabetic mice given diets fortified with peanut oil had significant reductions in blood sugar.